Do you struggle with any side effects, any health concerns because of the vegan diet? Because you were vegan for 8 years.
8 years. And shout out to my wife for tolerating me.
Was she vegan with you?
But it was more vegan and vegetarians. I just want to say that first. And I did it because and even my patients, my God, they would come in and they were trying to do their thing. But for me, it was more staying bloated, having gas,
Mm.
uh, having that irritability. But I think about this in a broader context, which is the big picture. And what I found is that the vegan diet is it has a lot of hidden side effects that we don't think about. And most of that is related to nutrient deficiencies, right? And when you're nutrient deficient, your risk for cancer is higher, your risk for stroke is higher, your risk for breaking your bones are higher, because of that vitamin D. Your risk for, just not thriving in general, your risk for hair loss, being
Yeah.
depressed. So all of these things are hidden side effects. So for me, the real issue is how do I deal with the potential deficiencies? I can be very smart and have all the information about what I need to worry about. In the community I serve on the south side of Chicago, that's very difficult for them to have a well-formulated vegan diet and be successful. So I'm going to still worry about B12 deficiencies. I'm going to still worry about vitamin D and omega-3 deficiency. And I see so many vegans come into my clinic who are iron deficient. So what I tell my patients is the following. Can you get most of the nutrients you need in a plant-based diet if it's well done? The answer is yes. If I'm thinking about B12, can I get enough B12 from mushrooms and nutritional yeast? Of course I can. But is it better to come from fish and red meat and eggs? Of course it is. Can I get vitamin D from mushrooms and algae and things like that? Of course I can, but is it better to get it from fish and egg yolks and beef liver? Of course it is. And even now we know vitamin D needs to come with K12. So if I'm going to do vitamin D, I need the K, and I call K12 the usher to kind of usher me from my arteries, which can clog my arteries, that calcium, and the joint, so I won't get arthritis. So the vitamin D will help you absorb the calcium, but it's the K2's job to then usher it into your bones. Well, guess where you get K2? You get it from animal source meat. You can get it a little bit from fermented foods, so you can get it that way, but it's not really optimal. I also think about my vision. I did have LASIK, so I cheated a little bit, Bella, and had LASIK. But I think about vitamin A, and yes, I can get vitamin A from plants. I can. But vitamin A gives us beta carotene, and beta carotene has to be converted to vitamin A. And there's only about a one out of, maybe 1 out of 12% conversion rate.
Right.
So to get the active form of vitamin A, it's going to be a little harder. So there's so many nutritional things, rather, so, omega-3, same story. The plants have this ALA type of omega.
Hmm.
We need the DHA and the EPA, and only about 5 to 10% of the plant omega is going to convert to the form we need. Same thing with iron. If we're iron deficient, and then we are getting a source of iron that's not as readily available, like non-heme. We need the heme iron from meat, which will be more available to the body so that I won't have to take twice as much iron to get to the RDA, which is still not enough. So what I find is that when I think about myself and my patients, why would I go down that rabbit hole when I can just eat a steak that has all of this good stuff in it? That's all I'm saying. So to me, it's like if I had a population that was able to do this and they really had good reason to do it, I absolutely think that's fine. But if you're going to look at the population as a whole, I think we do much better by giving them the essential amino acids and fatty acids you see in animal foods so that they won't have to worry about all of these details. The only thing I even think about is I may take omega-3 because I don't eat as much fish. I may take I periodically I will take maybe some type of mineral or maybe magnesium, potassium, sodium, because with this dietary pattern you may lose those electrolytes. But for the most part, I don't really think about it. But you have to think about it if you're plant-based, and that's why I think this is a better dietary approach when it comes to carnivore and keto.
Have you faced any backlash from the medical community for your dietary switch?
When I first started my journey, I really wasn't doing videos on YouTube. I wasn't doing a podcast.
Mm.
Um, in our health system, Advocate Health, we're expected to follow the guidelines, but we're also allowed to be our own type of clinician, right? So I never got a lot of backlash, and I think and what I try to do is I try to, when I frame things, I try to frame it through the lens of other people. So I understand why a person who's vegan is vegan. There may be religious reasons, there may be cultural reasons. So there may be animal rights reasons, right? So, and although I may not always agree with those reasons, environmental reasons, I understand that that's what it is. So I just try to make sure that when I'm messaging, I always message in a way that honors the person in front of me. And because I approach it that way, and because I'm a kind of a nice guy and I'm easygoing, I'm not making fun of people on YouTube, I think people are comfortable. In fact, when I was at the Society of Metabolic Health, the Society of Metabolic Health Practitioners conference in the summer of 2023, my topic was how vegans and carnivores can live in harmony. That was my topic because I do believe that that's a true thing. And it may require us moving towards regenerative farming because that way you honor the animals and you also honor the plant-based approach is more ethical, etc. But what I try to do is help people understand that, for example, you can't like have plants. If you raise a lot of plants, you're gonna harm animals. There's no way around that. So what you do is you provide context and say, if I have a lot of plants being grown, I have to protect the plants. So I'm gonna put stuff on the plants. It may hurt the bugs. Well, if I kill the bugs, the rodents and the birds have to eat too. So we have to be honest about these things. But more importantly, we have to be honest about what kind of world do we want to live in? Do we want to live in a world where we have an intellectual conversation about what's best to eat, what's not best to eat, and we just have a nice, friendly debate about it? Or do we want to live in a world like in New York, where on Mondays and Fridays you can't eat meat? Because if we flipped it, and on Mondays and Fridays we only eat meat, and we don't let the plant people eat the plants, then is that the world we want to live in? Where we're kind of forcing people to adopt our belief systems, which are only based on our life experiences, which may or may not be serving us. Because before I was an animal-based diet, my life experiences told me that the plant-based diet was the best diet. But then additional life experiences taught me that that may not be the best for Tony. So we just want to live in a world where people get information and then they're allowed to make their own decision. That's a better world. That's the American way for those who are in America, hopefully in more places in the world. And I think that's a better model so that people can then make the best decision for themselves. So that's the approach I take. And that's why I don't think I get a lot of pushback. Even though I'm in a large health system, conventional health system, but I'm able to kind of message this model with my patients. And as I lead things like the food pharmacy and other programs, I'm able to message that in a way that serves everybody. And even though I'm a carnivore, a food pharmacy is growing plants. So how ironic is that, right? But I think that for those who want to eat that way, they should be allowed to understand it's about eating real food. That's the number one goal. And then you then decide which of the real foods is best for you. And for me, it's an animal-based diet.